I am Dr. Krishna Prasad Vunnam, Managing Director, Ankura Hospital for Women and Children. When it comes to pediatrics and neonatology, it is around 1000 billion market in India, and whereas private sector is around 70% of it is for in private sector and around 30% is in public sector, which is growing at around 12% year on year. So there is a tremendous opportunity for the hospitals like Ankura Hospital to capture the market which is readily available. When it comes to pediatrics and neonatology, if you look at around 25 years back, there were not many neonatal intensive care units, pediatric intensive care units, and pediatric super specialty services in India. Only few of the metros are offering the services of pediatric super specialty, including neonatal intensive care. And now the times have changed, and private sector has penetrated in deep in India itself. And now you can see there are so many neonatal intensive care units, not only in tier 1 cities, tier 2, tier 3 cities as well. And the neonatal mortality, perinatal mortality are coming down. Under 5 mortality also is coming down. And also even in public sector, government is very aggressively adopting the new technologies in terms of getting new incubators, new ventilators specialized for neonatal care, like extremely premature babies. Even the government hospitals are able to save the babies as low as 500-gram babies, and who are born at around 6 months of gestation, which was not the case 25 years back. Now the private sector, we are able to save up to 350 to 400-gram babies. So which is on par with global standards, which we are able to do with the help of latest technology. I mean the latest incubators and latest ventilators which are available now, and which were very difficult to import at that point of time. Now we are able to import with the help of government, and government is also helping us in getting these machines and these technology to India. We didn't have these many super specialty doctors like neonatologists, pediatric intensivists, pediatric neurologists, pediatric gastroenterologists, rheumatologists available at that point of time in India. At that point of time, the only option was those whoever were trained abroad, they come back to India and establish pediatric center, and they were able to cater to the population in and around that hospital. But now there are super specialty courses which are available in India. So we are able to get the right kind of resources now in India itself, those who are trained for the needs of Indian population. That is making the real difference now. I have done my neonatology training in Australia, Melbourne and Sydney. I have come back to India in year 2011. I worked as a consultant neonatologist in one of the premier children's hospital for 1 year. When I was working in that hospital as a consultant, then I realized actually there is a real gap between what we are providing and what actually patient needs. And also the super specialty services are available only to few, and whereas the need is there across India. Then we thought there is scope for us to come up with a hospital like Ankura Hospital for Women and Children, where we cater to the maximum population, and we can actually spread it across and give the same kind of care across to maximum population. That was the idea when we started Ankura, and we started Ankura Hospital for Women and Children in year 2012. So our journey has started in year 2012, and now in the year 2024 we have total of 15 branches spread across 4 different states: AP, Telangana, Maharashtra and Bhubaneswar. The recent one being the Bhubaneswar branch, which we launched very recently, and it's exclusive women and child hospital. So total of 1400 beds we have across 4 different states now. And in the year 2022 we have started fertility services as well by the name 9M Fertility by Ankura Hospitals. We started our first branch in Kukatpalli, Hyderabad. It was only 70 bedded facility with complete quaternary neonatal intensive care and pediatric intensive care units, and all pediatric super specialties under one roof. It was only children's hospital when we started in the year 2012. And we have faced a lot of challenges when we started, because we were all clinicians who started this hospital, and we had a lot of administrative issues and issues related to patient experience. It took time for us to overcome, to understand the needs of the patients, and also to give the kind of care what they really need. And once we understood that, and we were able to make it a big success, then we thought we should replicate the same. and we should go to some other area in Hyderabad itself and try to give the same kind of care what we are providing here. We have established our second center in Hyderabad itself. It's a Begumpet in Hyderabad, where we thought we should extend our services also, scope of services. We have started Women and Child Hospital. So we have started maternity and gynecology services also under one roof, along with children's services. And we had a lot of challenges when we started our Begumpet branch. That was the second branch, and we had administrative challenges, issues related to doctors and facility issues. So that has become a failure for us. So our second branch was a failure. That led us to go back to drawing room, and we have worked on what are all the areas where we have gone really wrong, and we have improved on it. We have improved on our processes and patient engagement, patient experience part, and we have opened our third and fourth in Hyderabad, Uppal and AS Nagar area, and we had those two were tremendous success. Then we thought we should replicate the same model in one of the district area in Telangana itself and see how we would be able to replicate the same. We opened one in Khammam, and that was also big success for us. In comparison to our competitors, we provide the quality of care at at competitive prices. That makes us, very different, and that is a big part of our success. At Ankura, patient safety and patient experience is utmost important thing, and we value it, and we have provided the infrastructure to meet the needs of the latest generation. So the most of the rooms are well ventilated and well lit, that we have taken utmost care to give the care and also kind of experience to the patient. And the waiting lobbies, the public toilets, and the kind of air conditioning, everything we have taken utmost care to give the best experience to the patient. We have plans to expand in the state of Maharashtra, in areas like Nagpur, Nashik, and one more branch in Pune itself. And we are planning to expand to Bangalore as well, and also towards eastern states like Calcutta and northeastern states as well.